Okay, so today we are going to study about schizophrenia. So, what is schizophrenia? Schizophrenia is a serious mental disorder. Okay, this is serious mental disorder affecting thinking, perception, and behavior. Like it is a disorder. It is not disease. It is disorder. There is a difference between disease and disorder, which we will discuss about in another video. So, in schizophrenia, it affects our thinking, our perception, and our behavior. Okay, in which the person loses touch with the reality and brain cannot properly differentiate real versus unreal. Okay, like, and cannot control thoughts and perception, means it does not able to believe it does not able to believe or differentiate between real versus unreal and cannot control thoughts. To understand this, we have to look for symptoms of schizophrenia. So, in symptoms of schizophrenia, there are positive symptoms and negative symptoms. So, these positive symptoms are the one which are added ones, and there are negative symptoms which are lost. So, the positive symptoms are kind of symptoms which are not present since birth, like hallucinations, delusion, and disorganized speech. These are the symptoms which are not present in the person previously. It is present only in the schizophrenic patients or any other kind of disorder which is in which hallucination or delusion are also symptoms. And the negative symptoms are loss one, like lack of emotion, social withdrawal, and low motivation. Like, normally in normal people, the emotion of any kind of sadness, happiness, any kind of anger, which is also emotion which is present, but in schizophrenic patient the emotion is not present. Like, we are also going to see the examples through which you can understand properly, and the social withdrawal and low motivation. Okay, so first we have to look for the examples. So first we are going to look for the examples of positive symptoms. Okay, like, in positive symptoms, the hallucinations come first. Okay, so in hallucination, a person hears voices talking about them when no one is around. Someone is calling my name even when alone. Hearing voices giving commands like don't go outside. Okay, so these are the complaints of a schizophrenic patients. Like, they hear voices. They are sitting doing something, their work. They hear voices if someone is calling them. Someone is talking about them when no one is around them. And they hear commands also, like don't go outside, don't do this, don't eat this, don't eat that, whatever, etc, etc. In delusion is a second one example. Okay, delusion is a second one example. So delusion means false belief. Okay, so person believes which is not truly present, like believe people are spying on them through TV, which is not possible, which is not true. Think they are a famous personality or have special powers. Feels others are trying to harm or poison them without any proof. Okay, so in delusion, the person start to believe the things which are not true, which are not actually the truth. Like, someone is spying on them, they have the special powers, or they have a famous personality. Like, they feel others trying to harm them, which is not true, which is not actually true, which is not present. And disorganized speech is the third one symptoms. Like, talking in a way that does not make any sense, jumping from one topic to another topic randomly. Like, talking in a way that does not make sense. Like, if you ask someone their name, like there is a person named Rahul, so you ask what is your name, he says Rahul. You ask where do you live, he will only say Rahul. When you ask what is your favorite color, he will say again Rahul. Okay, and jumping from one topic to another topic randomly and saying unrelated sentence like I went to the market, sky is blue, and my friend is a clock. So there are three sentences which are not making any kind of sense. Okay, so hallucinations, delusions, and disorganized speech. These three are the symptoms, positive symptoms of schizophrenic patients. So come on, look into negative symptoms. So in negative symptoms, there is first is lack of emotion, like it is a flat affect, like no facial expression while talking. The person talking, but they don't have any kind of facial expression. They don't even sad, happy, angry. They have a flat face, like no any kind of expressions. Not showing happiness even during good news. If you some student, they passing the exam and you give them good news that you are passed, but they will not show any kind of emotion, like they are happy, their face will be flat, no any kind of sadness or no any kind of happiness. Voice sounds dull and emotionless, like when we talk, when we happy, we talk in another way, when we sad, we talk in another way. But in schizophrenic patient, their voice is dull and they sound like emotionless. And the second one is social withdrawal. Avoid friends and family. Like normally people are like to meet friends, family, but schizophrenic people avoid friends and family. They prefer to stay alone most of the time. Stop participating in social activities. Okay, and the third one is lack of motivation. Okay, so in lack of motivation, like they are not interested in studies or daily tasks, unable to complete simple work like bathing or eating regularly, and sit idle for long periods without doing anything. Like they are not interested in their work. Like if they are student, they are not interested in their studies. If they are doing any kind of office job, they are not interested in. They are also unable to complete their simple work like bathing, eating, or doing something simple thing, and they can sit in an ideal posture for longer period of time. Okay, so in the next video we are going to talk about the mechanism and the which happens in brain in schizophrenic patient. What are the diagnosis and treatment. Okay.